So before doing this procedure, I'd make sure that I just have my equipment and everything. I'm going to be doing the double lumen nasogastric tube with suctioning. So before, I would make sure to just have my things that I need, and then I would go ahead and go into the room and knock and introduce myself. Hi, how are you? My name's Vacation. I'm going to be your student nurse for today. Provide privacy. Pull the curtain, provide privacy. Perform hand hygiene. Identify the patient. Ask for pain and allergies. Look for arm bracelet. Sir, could you please state your name and date of birth? Great. No pain, no allergies. Explain the procedure to the patient. So I'm going to be doing a nasogastric section. So basically, this is just to help relieve some nausea, vomiting, help you just get feeling better. I would go ahead and put the bed to waist height. Just get a comfortable position. I would assess the abdomen. I would want to listen for a minute in each quadrant of the bowel. I would first want to inspect it, and then I would auscultate and see if there's 5 to 35 gurgles per minute. I would also note if there's any distension or tenderness. So after inspecting, auscultating, then I would move into palpation and ask the patient when was the last time they had a bowel movement. So I would make those assessments and go ahead and document those. So after assessing the bowel, I would then go ahead and get ready to put in the nasogastric tube. I would first want to make sure that my equipment is working. Suctioning is on. I want to do it to 120 to 125. I'm going to go ahead and set it to 120. Make sure it's working. Just leave that on. Leave that to the side. I want to make sure there's no kinks or anything. Then I'm going to go ahead and take my tape. Find the ending. I would then go ahead and put on gloves. I would go ahead and first put this blue pad over the patient. This is to make sure to just protect your gown. Give them a cup. It's not really a cup, but this is all we have. And I would tell them that this is to be used. I would also give them a straw that this is to be used. So once I hit the gag reflex, they can go ahead and sip a little bit of water to help ease the process of putting in the tube. So I'm just going to go ahead and put some gloves on. So first things first is I would make sure to get my tubing. I would make sure that it's in an unopened package, but since we have to reuse. Hello.
I'll be your student nurse today. Can you please state your name and date of birth?
Okay. Remove that old tape. So I would want to go ahead and measure
And are you allergic to
from the tip of the nose to the xiphoid process.
Alrighty. And do you have any pain? Alright. Well, we're going to try to relieve some of that pain for you today. We're going to be inserting a nasogastric tube.
So that is about
with irrigation.
40 centimeters.
I'm going to raise you up here.
I would go ahead and make sure to measure that with my measuring tape though.
I'm going to lean you out just a little bit.
And I would use a tape to put it, to just confirm.
Alright. And then
Okay.
before
So that is
I
40
insert the
centimeters.
gastric tube, I'm going
Okay.
to assess the abdomen, just check for
So then I would go ahead and
distension,
ask the patient to occlude
make
each
sure
snare.
there is bowel sounds in each quadrant for a full minute. Just to make sure, since we're gonna.
It appears that there's no, actually there is something for the cap to be able to,
And then I'm going to inspect
kink,
first.
to kink it
make sure
together so that
there's
way
lesions,
it can be,
distension, that type of
okay,
stuff.
so
and then
now
I'm
that I
going
have
to
my,
auscultate. So I'm auscultating in all 4 of the quadrants.
tubing measured,
Just to make sure I get
I'm gonna
proper assessment.
get the Shelly, ask the patient what patient it's, which narrow it's easy for them to breathe out of.
So,
If it was the left, I would make sure and just use the left.
a little bit
So we'll say that
just
it's
to prevent any cause
the
of
right narrow,
aspiration,
since I'm on the right anatomical
stuff
side.
like that.
So then I would go ahead and lubricate it 2 to 4 inches.
So I'm going to set this on the patient.
Okay.
I'm
And
gonna
then I would go ahead and begin the
space in there
process
just to make sure.
So
that
sir, go ahead and
if he
move
needs
your
to
head back.
Cough, spit up,
And once you
throw
start
up,
to feel the
anything
gag
like that.
reflex, then go ahead and just move your head forward down to your chin to your chest. All right, sir, go ahead and relax.
I would also have a cup with some water right here. That when we're placing the tube, they have the option to swallow just to help ease that tube down into the stomach.
So it's not actually going to go in all the way because this is as far as it'll go. I don't want to let it go until I put
I'm
it
gonna get
in.
my tube ready here.
I'm going to use another tape to secure this. Okay.
Alrighty, and the way I'm gonna measure
So my
my
tube is
tubing,
getting secure
to
now.
make sure I get in the stomach,
Um,
is I'm
I'm
going
then going to go ahead and
measure
I would measure it afterwards
from the nose to the ear,
to note the outside measurements.
and then I'm gonna go from the ear to the xiphoid process. I'm gonna mark this with a piece of tape. Okay, we're at about 40, which is about normal. The length depends on the height of the person. So I'm going to lay this tubing right here.
It's about 77 centimeters. So I'd make sure to just document that. So now that I put in my tubing,
1.5 for the adult.
I'm then going to go ahead and flush. Or actually no, I would actually aspirate the gastric contents. So of course I would get an open syringe, and this is just to check and make sure that the tube is in the stomach. So I'm just going to go ahead and take my syringe, take just enough, about 5 mils of gastric contents.
So I have it ready.
Go ahead and plant it. Okay,
It's
plant. And then I'm going to go ahead and take my pH strip, put a little
Also going to attach a pulse oximeter to the patient and have the patient be wearing that throughout the procedure, just because we're going into the nose, which can cause respiratory distress and things like that.
Okay, so I want to just go ahead and place that there. I'm going to give it a minute or so, and then I want to make sure that it's less than 5.5, which will show that it is in the stomach, since it is acidic. So now that I've checked, I would take any remaining gastric contents and I would put it back into the tube.
If they have one that
So now that I've go ahead and measured how much that once that I have verified that it is inside the stomach,
spray it just on there.
I'm then going to go ahead and flush with 10 mils of water, sterile water. So I'd go ahead and
So you can have the patient
about
lean their
10
head back.
mils.
And then when I reach the gag reflex, I'm gonna have them do chin to chest and
Okay.
take a drink of this water right here. So
And
deep
then when I
breath,
go ahead and get
go in,
10 mils.
and then I'm going to hold this right here. I don't want to let go of it. If they sneeze or cough,
Okay.
it will fall out.
So it's about 10 mils, and I want to go ahead and flush.
We don't want to have to do it more times than we.
So I'd go ahead and instill that.
I'm going to hold this.
Okay, until it ran clear. Okay, so now that I've done that,
Place. I'm going to tape it.
I would then go ahead and make sure that the blue air vent is also flushed as well. Just to make sure that there's no anything backed up in there. So I would go ahead and just take about 10 mils of air.
Just want to make sure when I'm taping that I'm not including that nostril that's open.
Okay.
This is my bridge tape.
And then I'm going to go ahead and use 10 mils of air.
So now I've got my
Okay.
tube
I
in
never want to
place.
put any liquid
So I'm
in
gonna
the
document
blue air vent.
measurement that it is inside
So now that
the
I've
patient,
flushed,
and I'm also going to measure
then I want
what's
to go ahead and
outside.
connect it to suction.
The outside measurement.
So here I have my
allows
suction.
If the patient is transferred or moved,
And it's
it
suctioning.
allows
I want to secure this to
people
the
in care
patient's
to see
hand
if it has
above the abdomen.
moved
So I could do
and
it with
whatnot.
a safety
So
pin or anything just to get it outside the
take out
patient's
this
way.
cover.
So once I've done that, then I would go ahead and leave the patient in this position
So I take my syringe.
for however long the order is said to keep it in. And I would come back and assess the patient every 30 to hour or so.
Check this. We want to cause
Can
less pain as possible. So
Reassess their abdomen, and once
right now I'm going
the
to
order said it
check
was time
for
to take out
gastric. I want to
the
make
tube
sure
is when I would take it
that
out. But
in the
for now, I'm just
stomach,
going to go ahead and leave it
anything,
there.
5.5 or less.
I would
just
leave
assures me
the
that we're in the
patient
stomach
in a comfortable
and that we're
position.
not,
Lower the
getting
bedside.
with anything other than the stomach. So I'm going to use them as a space, and I'm going to aspirate a very small amount of contents.
Ask the patient how they're feeling.
And
Could
put on
also
this
assess
pH
their
strip.
vitals, just to make sure that
So
they're
it's been confirmed that we're in the stomach. Okay, we're
not
at
hypoxic
5
or anything.
pH.
So now that I've done
I'm
that,
going to include this just for a second to keep anything from
just gonna
from
double
coming
check
up
real
and
quick.
whatnot. Okay. So we always want to measure accurately what we're putting inside. That way we know what to get out.
I just want to make my
So I'm
necessary
gonna irrigate this
documentations,
tubing.
just make sure the patient's
I'm
good,
gonna irrigate
and then I
it
would go ahead
with,
and dispose of my
20 to 30
supplies,
milliliters. So I'm
take
going to go
off
about
my
25
gloves.
right in the middle.
perform hand hygiene. Just make sure that the suction is where it
Okay.
needs to be.
So that,
I would
and
exit
I'm
the
going to
room.
put it in my